What is menstrual hygiene? Practices used to ensure cleanliness and protection of the private parts during menstruation is called menstrual hygiene. A number of products are used to maintain menstrual hygiene, such as sanitary napkins, menstrual cups, or tampons. It could be a ready-made sanitary napkin or a homemade pad made of reusable cloth. The frequency of change is important, and so is the associated body washing and daily bathing. The washing, drying, and storage of reusable pads is also important. Menstrual hygiene practices are heavily influenced by water, sanitation, and hygiene facilities at the household level, and access to a private and safe washroom is very crucial. The quality and access to these facilities varies significantly within a region or a country, especially in an urban versus a rural setting. Menstrual hygiene is also heavily influenced by the socio-cultural context, where a lot of myths and misconceptions exist around menstruation even today. Hence, it becomes extremely important to talk about menstruation and menstrual hygiene and the short-term and long-term complications that can be caused by a lack of maintaining that hygiene. What is your advice on personal hygiene during menstruation? Maintaining personal hygiene during menstruation is called menstrual hygiene management. My advice is to remember a few things. Ensure that you change your sanitary napkin or pad depending on the flow of the menstrual blood and the size of the pad. A menstruating person could use a minimum of 2 to more than 2 pads per day. A good rule of thumb is to ensure that the pad is fairly full and not yet leaky. Also ensure that you keep your private parts clean using soap and water. Sometimes even using clean water is adequate. If you're using reusable cloth, make sure to dry them completely and store them in a dry place, as damp cloth could lead to fungal infections. Please note there's absolutely no need to douche the vaginal area or internally clean the vaginal area. The vagina cleans itself periodically through a normal physiological process, and the use of chemicals to clean it is absolutely not required. Also note there is no need to apply creams or chemicals to keep your private parts clean. Never apply powder to your private parts, especially remember this in the case of children. What are the long-term repercussions on health if menstruation hygiene is not well maintained? If menstrual hygiene is not well maintained, there could be a number of long-term repercussions on the health of the menstruating person. Repeated infections can cause reproductive complications such as pelvic inflammatory disease, infertility due to blockage or infection of the tubes, pregnancy loss, preterm delivery, or even cause low birth weight in the baby. Irrespective of fertility issues, repeated reproductive and urinary tract infections can lead to malignancies and cancer later in life. What are some of the most common menstruation myths? There are a lot of myths and misconceptions around menstruation in the Indian subcontinent. But the biggest myth is that the menstrual blood is full of toxins that are removed from the body every month, and that the menstruating person is impure during the time of menstruation. Women and girls are conditioned from a very young age to believe this myth, and families ensure that they are segregated from family activities during menstruation. This is nothing short of practicing modern day untouchability within our own homes with our own daughters, sisters, mothers, and wives. And then these women and girls continue to pass on this conditioning to the next generation. This definitely has long-term psychological and physical implications on the person who continues to be conditioned in this way. The blood that is shed during menstruation actually nurtures a fetus in the womb if a baby is conceived. So how can that blood be impure or toxic in nature? This is a reflection we must all do if we believe that women and girls are impure during menstruation. Every woman and girl needs to be given the privacy and dignity to menstruate in a safe and hygienic way, as this is a normal bodily function. Is there any information on how many women are affected annually? There are about 116 million adolescent girls aged 10 to 19 years in India. In absolute numbers, India has the largest adolescent population in the world. 1 in 4 women in the reproductive age group, that is 15 to 45 years, in India has an infection, and the prevalence varies between 19% in some states to 71% in other states. Data shows that women and girls living in remote rural areas have poorer access to hygienic methods compared to urban areas that may have easier access. And we know that the government has a number of schemes to mitigate this gap. At Cure Bay, we're tackling the challenge of providing access to reproductive healthcare in remote parts of rural India. Our e-clinics are located in villages, staffed by nurses who can immediately connect a woman or a girl to an OBGYN via telemedicine through a virtual platform. We also ensure immediate access to medicines that are prescribed by the doctor. Remember, menstruation is a normal bodily function, but infections caused by poor menstrual hygiene can be prevented or treated. Seek care from a healthcare professional today. What are the problems caused due to lack of menstrual hygiene? The most common problems caused due to a lack of menstrual hygiene are urinary tract infections and reproductive tract infections. The most common complaints being itching in the private parts, excessive vaginal discharge that may or may not be foul smelling. Sometimes there's burning sensation while passing urine, low backache, and pain during intercourse or sexual activity. Some of the most common infections are bacterial vaginosis, Trichomonas vaginalis, fungal infections like Candida, and yeast infections. All of these can be easily treated with doctor's advice without causing long-term complications. The most important thing is to maintain menstrual hygiene and seek healthcare as and when problems arise and not to wait for too long.